Imagine someone you know, a close friend, or a sibling, or even a parent figure, lie in a hospital bed due to some sort of disease, treatment, or accident they previously occurred. And the only way to get them out of that bed quicker is by them receiving a blood transfusion. Now, and one of the ways to make sure they get that blood transfusion faster is that if a single person does a simple procedure in a quick amount of time to donate blood. Today, I would like to talk to you about why blood donors are needed, how you may become a blood donor, and how, if or when you become a blood donor, how it may affect your community and the very people around you. Now, it may not be a happy thought, but it's likely that someone you know, such as a close friend or even a family member, to have some sort of hospital-worthy accident or just go to hospital because of surgery or things like that. And those things may require them to have a blood transfusion, a plasma transfusion, or even a platelet transfusion. Now, and to increase the chances of them getting those sort of transfusions, it's better if someone like you and the people around you to become blood donors, so that there's a more abundance of those bloods and platelets and stuff. So I'll start with the main reasons why there is a need for blood donors. So people around the world and the very people in our community sometimes may have accidents, surgeries, and all those other stuff, and they may need a transfusion of some sort. So now some of you may be wondering, where do you get those extra blood, extra plasma, extra platelets? So there are numerous things inside a person's blood. There is platelets, plasma, and red blood cells. So the way we receive these different blood cells is by donation. So there's whole blood, platelets, and plasma. So what's the difference between these two things? Well, according to an article written by Alexandra Athanopoulos in the newspaper called The Bustle, whole blood takes a pint of blood between the donor and takes roughly around 15 minutes, and you can donate around every 56 days. And the donation can also be separated between the blood can be separated between its platelets, plasma, red blood cells, white blood cells, and stuff like that. Platelets is a bit trickier. It requires a machine called apheresis, which extracts the plasma or platelets from the person's blood and returns either the platelets or plasma or red blood cells back to the donor. Both of these take roughly around 2 hours to do, and you can donate every 2 weeks. So there are different uses to this. So according to the American Red Cross, whole blood is, it can be separated between its three main components, and it's mostly used due to surgery or someone with major blood loss. And for platelets, it's mostly determined for people who have cancer patients, cancer treatment, or an organ transplant. And finally, plasma is mostly for people who have burns, shocks, or clotting deficiency of some sort. So, my bad. So, how does one become a donor? So, according to the Memorial Sloan Kettering Cancer Center, there are numerous factors to make you a donor. One of these is age. So at the age of 16, a person can donate with parent consent. At age 17, you no longer need that consent. And all the way to your age of 76, you can donate as long as you have a doctor's written note. As well as you have to be in healthy condition, so that when you do extract your blood or other donations, you can perfectly walk around safely after it. And you have to at least weigh 110 pounds, and as well, you also need some sort of form of ID to prove that you are who you say you are. So according to the register, there are numerous factors that make people non-eligible to become a donor. Some of these include, AIDS, body piercings within the last 12 months, as well as tattoos. If you've ever been in prison, if you're pregnant, if you ever visited the UK or Western Europe due to chance of you receiving the mad cow disease, and as well if you took any other antibiotics or other medications that might affect you, and of course other symptoms as well. So, currently, as we speak, there are family members, friends, co-workers, people you know, people you see walking down the street that may be in need of blood right now. and those people are depending on the blood donation. So even infants who just left the womb need a blood donation of some sort. So in Houston, or more specifically the Gulf Coast region of Texas, has a specific blood center called the Gulf Coast Regional Blood Center. And they simplify the version for blood donating very easily for anyone who wants to donate. They have easy access online, numerous locations throughout Houston, throughout Texas itself, and it even helps the local hospitals and emergency rooms in the area. So, do you guys have any questions?
Yep. Is there any negative effect to the donating blood?
No, there are no major negative effects of donating blood, as each needle and each procedure is renewed and everything. Each system is cleaned out before each use. So the only probably negative effect there is that we may hit an artery by accident, but the professional staff at the locations are well trained for that procedure.
Yeah. My question is, can anyone with the pre-diagnosis, medical condition such as Down syndrome donate?
It depends on such pre-diagnosed conditions. When you do donate, they do ask you a lot of questions, so whether what disease you have, if you have any diseases, and stuff like that. For the most part, most of those diseases that concern genetics and stuff like that are allowed to donate as long as they require all the other benefits and stuff like that. But if it affects your blood, or if they have any AIDS or stuff like that, then no, they cannot donate blood. So blood and platelets is mostly based on the blood, not based on genetic diseases or anything like that. So any other questions?
No. Thank you.
Thank you for your time.